What is sinusitis? Non-specific term refers to inflammation of paranasal air sinuses. Remember, itis mean inflammation or swelling. So now let's brief the anatomy of paranasal air sinuses. There are 4 sinuses. Frontal paranasal air sinus, ethmoidal paranasal air sinus, maxillary paranasal air sinus, and sphenoidal paranasal air sinus. And the main function of these sinuses are reducing the weight of the skull, conditioning and moisturizing the air, adding resonance to the voice. And these sinuses are entirely surrounded by mucous membrane and constantly producing the fluid that drains through the nasal cavity. So when inflammation involved nasal and sinus mucosa, we refers to it as rhinosinusitis. Sinusitis are clinically types or groups into 2. 1. Acute sinusitis. 2. Chronic sinusitis. So let's see acute sinusitis. Acute inflammation of paranasal air sinuses mucosa. It occur and last in less than 4 weeks duration. If nasal mucosa involved, we refers to it as rhinosinusitis. What are the common features of acute sinusitis? 1. Fever. 2. Headache. 3. Postnasal discharge. 4. Nasal congestion. And abnormal sense of smell due to obstruction of sinus drainage to the nasal cavity. What are the common etiology or causes of acute sinusitis? 1. Viral upper respiratory tract infection. 2. Dental caries. 3. Preapical abscess. 4. Oroantral fistulas. So now, what about the common risk factors for acute sinusitis? 1. Indwelling nasogastric tube insertion. 2. Endotracheal tube insertion. 3. Allergic reaction and 5. Young age. How to diagnose acute sinusitis? We diagnose it using the following. 1. X-ray image seeing ossification in sinus cavity due to fluid accumulation with or without gas. 2. Fluid levels. 3. CT scan image, which is the most common method for evaluation of mucosal thickening. Gas fluid level with rhinitis. 3. Magnetic resonance imaging. T1 image appear hyperdence image. And T2 appear hyperdence. Treatments of acute sinusitis. 1. Medical treatment. And functional endoscopic sinus surgery. What are the complications of acute sinusitis? 1. Superiosteal abscess. 2. Dural venous thrombosis. 3. Meningitis. 4. Subdural empyema. 5. Cerebral abscess. What about the chronic sinusitis? It's the long-term sinus infection or inflammation. Most commonly affects young to middle-aged adults. The common features of chronic sinus infection are: it lasts for more than 12 weeks duration. Nasal obstruction. Discharge. Facial pain. Headache. Halitosis. Anosmia. The common major causes of chronic sinusitis are: 1. Sinonasal polyposis. 2. Chronic allergy. 3. Odontogenic cause. How to diagnose it? Coarse sclerotic bone thickening like hyperostosis. Intrasinus calcification. Finally, the treatment by functional endoscopic sinus surgery.